Hi. We are nursing student of Sem 4. Today, we will talk about nursing management of gestational diabetes mellitus. Today, we will talk about nursing management of gestational diabetes mellitus. There are several nursing management that we are going to talk, such as assessment of patient's condition, blood sugar level monitoring, diet control, insulin therapy, health education, fetal monitoring, exercise and management of infection. We will discuss it one by one. Firstly, as a nurse, we should do an assessment of patient's condition. We should assess the patient's history of GDM. We should identify it to prevent any complication during pregnancy. Assess physical condition by assessing the patient's blood pressure while sitting and standing to detect orthostatic changes, the body mass index and visual acuity of the patient, and performing examination of foot, skin, nervous system and mouth to detect any abnormalities such as edema. We should ensure that the laboratory examinations such as the 1C, facile, microalbuminuria test, serum creatinine level, urinalysis, and ECG must be requested and performed. Next, the nursing management of GDM is blood sugar monitoring. Maternal blood sugar monitoring is performed regularly. We need to educate patient about self-monitoring of blood sugar level at home to control blood sugar level. For example, for first trimester, glycosylated hemoglobin, HbA1c, HbA1c, is performed every 3 months for glycogenic control and oral modified glucose tolerance test, MGTT, or blood sugar profile are done throughout the day for the third trimester. Thirdly, diet control must be emphasized towards the patient. It is vital to keep blood sugar level is in normal range during pregnancy. Initially, a diet of 30 calories per kilogram body weight with 60 to 70% carbohydrate and fiber is introduced. Encourage pregnant women to take low sugar and carbohydrate content and take food high in fiber such as fruits and vegetable as indicated in healthy plate method. Next, consult the patient with a dietitian for further nutrition management. Next, administration of insulin therapy as prescribed by doctor. For patient who had oral medication that not function well to decrease the blood sugar level, need to shift to insulin therapy as prescribed by doctor. It is for ensure the control of blood sugar level and prevent any complication towards the fetus. In addition, it is easier to adjust insulin doses to maintain around-the-clock glucose control, than to adjust doses of oral diabetes medications, as insulin doses can be adjusted meal by meal as indicated. As a nurse, we should do health education towards our patient. Provide information about GDM, its complications, treatment and self-care management. Next, instruct pregnant mother to comply to attend follow-up appointment with obstetrician, for monitor the progress of pregnancy and ensure maternal health and fetal development is in good condition. Encourage patient to do family planning in future because it can reduce the rate of mortality and morbidity during birth. Fetal assessment must be performed to identify fetal growth and the placenta's ability to provide oxygen and nutrients. It can be assessed via ultrasound examination. It can identify any abnormalities such as macrosomia, polyhydramnios in woman with poorly controlled diabetes or oligohydramnios in placenta failure. Next, fetal heart rate can be monitored by stethoscope, movement estimation, Doppler and bioval are done to detect fetal hypoxia. Fetal movement chart are done. Fetal movement chart is done during pregnancy. It is for assessing fetal well-being and growth development, especially in high-risk mother. It can reduce perinatal morbidity and mortality rate. It can be performed at 28 weeks of gestation. Educate patient to count the movement every day, preferably at the same time. Monitor fetus movement up to 10 time of complete 10-time fetus movement every day. Furthermore, exercise is important to keep maintaining blood sugar level in normal range. Encourage patient to do light exercise regularly during pregnancy, such as walking or yoga for at least 30 minutes for 3 times a week. However, the strenuous exercise must be avoided because it may harm the fetus. They should be taught to count their heart rate and given a range that is healthy for them, and their feet should be taught to evaluate themselves for uterine contractions and to stop exercising immediately if occur. Next, management of infection is important towards pregnant women. With pregnant women, we must educate patient about causes of infection occur, such as bacterial, virus or parasites due to poor hygiene care. Describe the signs and symptoms of infection such as fever or flu. Explain the treatment of infection. We must advise healthcare provider to get treatment. Advise patient to not buy over-the-counter medicine to prevent any complication towards patient and fetus. Educate patient about the prevention of infection by educate patient about perineal care by washing from front to back by using mild soap and water and keep clean and dry to prevent infection. Next, advise patient to choose suitable underwear such as cotton. Educate patient to avoid using panty liner and feminine hygiene as it may introduce infection. Encourage to clean perineal area and urinate before and after doing sexual intercourse. There are several nursing diagnoses of gestational diabetes mellitus. Firstly, imbalanced nutrition, less than body requirement related to inability to utilize nutrients appropriately. Next, risk for maternal injury related to changes in diabetic control. Besides, risk for fetal injury related to elevated maternal serum blood glucose level and deficit knowledge related to misinformation of gestational diabetes mellitus.